Hello, everybody. I'm Leonardo Bacherini, and together with Dr. Fradeani, I will be one of the speakers of the next course that will be held in Tashkent in November 4 and 5, with the title of A Modern Approach to the Prosthetic Rehabilitation. It will be a very intense course about to treat a compromised dentition, about the prosthetic rehabilitation of compromised dentition. We will see how important is a correct diagnosis and how important is the correct formulation of the treatment plan. And we will see also some clinical steps. So when we treat a compromised dentition with the full mouth rehabilitation, we have to follow a systematic approach that includes an aesthetic analysis, a correct aesthetic analysis, a good functional analysis, very important to avoid failures, and to obtain a good integration of the rehabilitation in the stomatognathis system. We will see how to send all the information to the lab, how to communicate with the lab, to send all the information, to do a good workup, and to fabricate a correct provisional restoration. Then we will speak about how to integrate the provisional restoration with the tissue, with the stomatognathis system. And at a certain point, a very important step is the copy of the provisional, to transform the provisional in the final restoration. Very important step. At the end, we will see how to select the ideal material. We will speak a lot about ceramic material, different material, how to optimize the use of all the modern ceramic material. Last but not least, we will see a lot of cases with long follow-up. Very, very important. So aesthetic analysis is the first topic of the course. It's very important, aesthetic analysis, to orient the rehabilitation and to define the incisal edge position. That is the starting point of every rehabilitation. It's the first step, the position of the 6 front teeth. Because most of the time we have to treat patients like this, with the teeth lost in the space. So it is very difficult sometimes to define the perfect position of the teeth. That can be this, or this, or this. Everything depends on many parameters. First of all, incisal edge position, then tooth proportion, then tooth exposure at the rest, smile line, anterior occlusal relationships. It means function, mandibular position, phonetics, and more. So we will see step by step how to collect all the information, how to process all the information to formulate the correct treatment plan. Obviously, we will see how to perform a correct aesthetic analysis with some digital tools, with a digital protocol. But then, functional analysis is a very important topic. We will discuss a lot about function. Functional analysis is very important to avoid dysfunction, to avoid failures, to understand the etiology of some wear. And it is also important to define the incisal edge position, but last but not least, it is very important to reduce the invasiveness of the treatment. Here you can see mainly the aspect that we will discuss about function. It means the equilibrium of the stomatognathic system, how to understand if the stomatognathic system is in the state of equilibrium or not, and how to understand the importance of some parafunctional activity. But sometimes, in absence of parafunction, also some inadequate dental occlusal relationship can cause excessive wear or failures, especially in the front teeth. So we will discuss a lot about this topic. And we will see how to manage two of the most important parameters of the occlusion. It means centric relation and vertical dimension of the occlusion. How to set up the vertical dimension of the occlusion. What happens when we increase the vertical dimension of the occlusion. And again, we will see the digital workflow to collect and to manage all the functional parameters, also dynamic data. Then you will see how to fabricate a correct provisional, how to reline in the mouth, and very important, the way to copy the provisional, the cross-mounting procedure. Then at the end of the course, we'll see how to select the material, ceramic material, and how to prepare with a minimal invasive concept of minimal invasive dentistry, and how to cement the model restoration, the protocol. So, as I said before, longevity is the point. We will see a lot of cases treated with all these concepts, and you will see how the restoration behave in the patient mouth over time. Longevity is very important. Last but not least, you will see a lot of cases treated with the MIPP, that many years ago was a prosthetic revolution. By now we have 14 years experience with this protocol, with this approach. Here you can see the definition, but mainly you will see a lot of cases. Cases like this, before and after, or like this, before and after, and the face and the smile of the patient before and after. So it will be very intense course, very interesting, very rich in knowledge, in clinical experience, in clinical steps, and tips and tricks. So don't miss this important event. Hope to see you soon in Tashkent. Bye-bye.